if you look at the last, 100 years in terms of how we've advanced medically to prolong life, prolong quality of life, at the same time, how has society changed, right? How our lifestyles changed. Medicine, we're hitting that point where medicine's not quite keeping up with our lifestyles, right? I mean, we're just cramming so much into every day. We're bombarded by stimuli at all times, and so Mindeo, I mean, combines so many individual, proven, interventions or therapies. It's unique in terms of the package. You see glimpses of it with, like, professional athletes have access to, like, some parts of it, but it's generally just, I've only seen it accessible at that kind of tier. I haven't seen it for the general public. My specialty is dementia, neurodegenerative disorders. So I'm used to treating that kind of disease, and that's really where the field has been shifting. We also, I know the analogous, on our side is we were targeting very specific, protein specific meds, and they really haven't panned out. And so everything in the pipeline now that's really showing promise is focused on inflammation, higher order, pathways. Most people lack that understanding, I see, again, analogies across areas of neuroscience, neurology, and psychiatry. Is people often think, oh, everyone in my family gets dementia when they get older. And no, that's not normal. That's not something that should happen. Same thing with TBI. It's, oh, I'm going to have a headache for a while, or, oh, I'm losing my balance, or I'm getting dizzy. It really comes down to the fact that, anything we do, like you point out, is, something like symptom focused. Like, okay, you're like had your TBI, now you're back to work full time. You had no rest, you have your kids, you have whatever, and so, okay, you have headaches. Here's a headache medication, but your brain never gets a chance to recover, and that tail just gets dragged out. I think it's no different across our biology, whether it's, depression or anxiety or a TBI, right? Like, we've heard it's affecting all kinds of systems, so you just can't pick, one little target. I think the reality is we need solutions like this because we have to speed up the healing process, or at least get to the underlying, inflammation. Because from what I see, people just don't have the chance. They don't have the time or the ability to fully recover. Like, try telling an adult, right? Okay, I need you to, like, just shut things down for 90 days. It's never going to happen, right? Once it's recognized that, wait a second, if my patients are doing Mindeo now before Chris's surgery, they're going to have less, hospitalization rates or faster recovery time. I think it's huge. I just don't think the average person really even has a chance to just take a breath. Just like we refer to physical therapy or occupational therapy or something, I could see this just kind of being one of those things to say, okay, I want you to do, a 12-week, package of this. You don't have to spend all day there. It's very smooth, so it's just in and out. You're not sitting in a waiting room. You're not, kind of stuck. Here's some actual guidance. Here's a place you can go. You're going to have to work a little bit, but we're also going to help you and, kind of hold your hand through this. I think it strikes a nice balance, right? It offers people a way to spend time on themselves, on their health, and take a time out, and then and do things that I think are calming these insults that Chris mentioned that are coming at you all day. Because when you get older, you just have less bandwidth for all those insults, but the insults don't slow down, So I have to remind my 80, 90, 95-year-old patients, you guys, you can't have the screen time all the time like a teenager. I mean, you're going to pay a bigger price for it, but there are ways to obviously help yourself. Definitely a question that comes up a lot. When I'm seeing folks with questions about decline as they get older, often they're with family asking the same thing, like kids or loved ones. I just gave a little community talk. I do these once in a while. I'm always tickled because I'm in front of, I was in front of maybe 200 or 300 elderly folks at, like, a kind of a big facility nearby here in Washington. And they always have these are the most common questions, what's normal, like, oh, I'm having trouble remembering names, or, I'm coming up with words. And, I have a few figures that I throw up, but on the wall to show, what, when you're 90, verbally, numerically, you should be just as sharp as you were when you were 30. There's no difference. There are things that do slow down with age. It's just more to do with attention and speed, but not ability, and people are surprised to learn their vocabulary peaks in their 60s. So, it's surprising. And I think that there are people out there that don't have a problem, but like Chris, I mean, the people we're helping are the people that need it, are not the people that are necessarily going to be like, okay, yep, every day now, 5 a.m. I'm going to go to, the gym. Hopefully it'll be like an Orange Theory type of, and spread everywhere and it'll be available. But the difference will be, you don't have to just force yourself to go.